Sup, chooms? Kept you all waiting, didn't I? Sorry about that, homies. You know how it is. Sometimes life throws a few assholes at you, and you need to wipe them out before you can get off the pot and get back to what's important in life, and that, of course, is fighting the good fight against hair loss. So, we've got a lot of work to do, chooms. We've got lots of research that needs to be disseminated, and lots of hairline fraud cells who need to be debunked. So, let's get right back into fighting the slaphead curse one video at a time. So, of course, fighting back against those who selfishly wish to fearmonger against conventional treatments like finasteride and topical minoxidil is of course very important, but it is also important we closely examine future potential armaments in the war against hair loss and see if they have any potential merit as weapons for us soldiers in this righteous crusade to destroy this fucking disease once and for all. I have had the tremendous honor of already exploring many future treatments on the market with you all, as well as existing treatments. This includes Wind pathway treatments like SM04544, as well as androgen antagonists like Breezula and pyrrolutamide. But are there any upcoming or presently available treatments on the horizon that may treat hair loss from an additional angle, which could give us that extra edge that we need to fight back against this genetic defect? Well, we already know that finasteride and minoxidil work extremely well and will be more than sufficient enough to halt further hair loss progression and regrow hair in over 90% of people who use them, even after 10 years, as has been scientifically proven. But 90% is still not 100%, so additional therapies that are proven both safe and effective are always welcome. And that is what brings us to the focus of today's video, Sandalore. So, before I discuss this treatment and go over how effective the research shows it is, and if it has any promise, it is first important that we explore the mechanism of Sandalore, as it works in a very unique, kind of strange way that is atypical compared to conventional hair loss remedies, as well as some unconventional hair loss remedies even. I mean, after all, we know that hair loss is caused by the trash hormone DHT, dihydrotestosterone, in individuals who have androgenic alopecia, so that is why treatments like finasteride and dutasteride obviously work, because they lower DHT levels on the scalp. But surprisingly enough, there is recent research showing that hair follicles have olfactory, which means smell receptors. In particular, they have a receptor called OR2AT4. But what does your hair having the ability to smell odors have to do with hair loss? Well, it turns out that this olfactory receptor is stimulated by the above-mentioned Sandalore, and stimulating this receptor actually causes IGF-1 release. And if you chooms remember what I have said about IGF-1 in my previous videos before, IGF-1 has multiple complex effects on hair growth. It is a hair growth and vascular growth factor, meaning a growth stimulant of the hair follicles and of the blood vessels that supply blood to the hair follicles, and also it prevents apoptosis of the hair cells, meaning it prevents cell death, which is what happens during the Catagen phase of the hair cycle. The Catagen phase is when the anagen growth phase of the hair turns into the telogen resting phase, when hair growth becomes inactive. IGF-1's role in hair loss is directly related to DHT, since the presence of DHT lowers IGF-1 levels. That means if DHT is not controlled on the scalp of men who do have androgenic alopecia, then there will be increased early hair cell death and reduced neovascularization of the hair follicle capillaries, which will inevitably lead to reduced blood flow to the hair follicles, which will in turn lead to the miniaturization and eventual death of the hair follicles that will then be irreversibly replaced by scar tissue. Now, of course, I must stress emphatically, as I have done many times before, that this is not the same thing as the blood flu theory. Your hair follicles are individual organs with their own blood supply, so just increasing blood flow to the scalp will not do anything to promote hair growth. If it were that simple, then doing anything to improve blood flow to the scalp would prevent hair loss, like cardiovascular training, for instance, or the use of blood pressure medications. Yes, I do know that minoxidil was originally conceived as a blood pressure medication, but that is not how it works. The mechanism behind minoxidil is not fully understood, but it is definitely not due to its effects on blood flow. Otherwise, all other blood pressure medications would work as well, and they don't. And if you want to see me thoroughly debunk this blood flu theory, I'll go ahead and link a video below for your viewing pleasure if you want to be educated on the subject. But anyways, You need to reverse the destruction of the capillaries that feed blood directly to the hair follicles rather than just improving blood flow to the scalp, and that's what IGF-1 does. And before you ask, no, sadly, you can't just supplement directly with IGF-1 to fight hair loss. This has been done in clinical research and has been shown to actually be counterproductive and possibly make hair loss even worse. And this is possibly because exogenous IGF-1 may actually increase the synthesis of androgen receptors in the scalp and thus increase DHT levels. And this may be why some bodybuilders report worsening hair loss when they take IGF-1 supplements as an ergogenic aid. However, if you have a genetic mutation called Laron syndrome, which is a disease that causes an individual to have naturally low IGF-1 levels and hair loss, then in that case, supplementing IGF-1 does help reverse hair loss, but for everybody else, it can actually make things worse. So I am getting a little off subject here though, so if you want to learn more about the role between IGF-1 and hair loss, I already created a video on it, and I'll go ahead and link it below if you want to learn more. So let's get back to Sandalore and how our hair's ability to detect odors may actually prevent hair loss. So we do have a couple of studies on the subject, including in vitro and in vivo studies. In vitro studies are important for establishing preliminary data and discovering mechanisms of drugs as well as testing theories as to how drugs work, but really it takes in vivo human studies for us to really prove that something works in humans, since cells in petri dishes don't always behave the same way as cells in a living, breathing human being. So the in vitro study was published in Nature in 2018, and it is entitled, quote, Olfactory Receptor OR2AT4 regulates human hair growth, unquote. They tested the effects of Sandalore in cultured human hair follicles. So not to get too deep in the weeds about how they performed the study, but the end results did show some beneficial effects. So we have two graphs here. The first graph shows Sandalore's role in raising IGF-1 levels in the human hair follicles. If you look at the green bar, that is just placebo, which is important because it shows the results aren't due to just chance. The blue bar shows the effects of Sandalore, which clearly increase the IGF-1 levels. The next bar, which is purple, shows the effect of a drug called Phenerat, which is a drug that specifically blocks the olfactory receptors of the hair follicle, and it has by itself an effect which is very close to the placebo effect. The last bar, which looks like an indigo color, is the effect of Sandalore in addition to the olfactory blocking drug Phenerat, and you can see that the IGF-1 levels do not increase, which strongly indicates that the effect of Sandalore on IGF-1 levels is mediated by the olfactory receptors. So you may be asking yourself right now, but Kevin, I thought you said too much IGF-1 was a bad thing. Well, let's examine that. It is true that IGF-1 is a bit of a double-edged sword, where you don't want to have too much or too little, since either will result in hair loss. So to better understand this, let's look at a more relevant endpoint than just IGF-1 levels. So take a look at this next graph. This graph looks at the ratio of hair follicles in the anagen versus the catagen phase. Remember, anagen phase is the growth phase, and the catagen phase is when growth stops and prepares to enter into the telogen resting phase prior to shedding, which is called the exogen phase. So the vehicle group, which is the placebo group, is just there as a control to measure up against the other treatments. Simply put, it didn't get any active treatment. If you look at the control group compared to the Sandalore group in the next bar, you can see significant increase in the percentage of hair follicles in the anagen phase. The last two bars again show the olfactory receptor blocking Phenerat and the combination of Sandalore with Phenerat, and they both show very little, if any, difference from just placebo. So now we see that Sandalore doesn't just increase IGF-1 levels, but it also prolongs the anagen growth phase of the hair follicle, which is the gold standard when it comes to judging the efficacy of any hair loss treatment. Minoxidil and finasteride both have very different mechanisms, but their end results are still the prolonging of the anagen growth phase, so even if the mechanism of Sandalore is completely different from existing treatments, it does seem to have some promise as a legitimate hair loss treatment, at least based on this in vitro study. So, of course, establishing a theory through in vitro research is good, but it's only the first step. You need actual clinical data to determine whether or not a treatment will be able to work. Fortunately, we have just that. We have an actual clinical study that appeared in March of this year, in fact, and the study is entitled, quote, topical odorant application of the specific olfactory receptor OR2AT4 agonist Sandalore, trademark, improves telogen effluvium associated parameters, unquote. So yes, I know what you're thinking. Telogen effluvium is not the same thing as androgenic alopecia, but keep in mind, Sandalore does not influence androgens, so it may not matter as its effects may be more comparable to something like Minoxidil, which also works without influencing androgen levels on the scalp, hence why Minoxidil is also used to treat causes of hair loss not directly related to androgenic alopecia, including telogen effluvium, which is trauma-induced hair loss, such as what you see in extreme cases of mental anguish, such as the death of a loved one, or due to physical torment, like has been reported by some POWs, for instance. So, I'm not saying we shouldn't bother testing this treatment in patients with androgenic alopecia, but we shouldn't dismiss the study since Sandalore does not work by an androgenic mechanism. So, in the paper's introduction, the authors talk about olfactory receptors, which normally we just think of as the smell receptors, but the researchers note something very interesting, and that is that the olfactory receptor is one of the most evolutionarily ancient receptors out there, and that these receptors predate even the appearance of the brain in evolution. So they have other purposes than just the sense of smell, because after all, what good would a sense of smell be without a brain to interpret those smells? So, like I mentioned before, there are smell receptors in the skin, specifically in the keratinocytes, the melanocytes, and the hair follicle outer root sheath cells. Sandalore, which is a synthetic sandalwood scent, stimulates these olfactory receptors in the skin, and like we saw in the graphs earlier, stimulating these receptors causes a prolonged anagen phase in the hair cycle, at least in vitro. There is a commercial form of Sandalore that is already available to consumers called Bioscale and Signal Revolution that contains 1% Sandalore in an alcohol vehicle. So this study is the first clinical study of Sandalore to see if it really lives up to its purpose in real human beings. But unfortunately, it turns out this study was funded by Giuliani Pharmaceuticals, who just happens to be very conveniently the manufacturers of Sandalore, as well as the former mayor of New York and former 2008 presidential candidate and frequent crossdresser. So let's put our political differences aside and examine the study as fairly as possible, although keep in mind, the study results may be biased since this is, after all, a study funded by the company. I mean, a biased study doesn't mean the study is wrong, of course, but regardless of the outcome, it would have been nice if we had some independent study which could confirm the reliability of the results here. So, anyways, this was a randomized, double-blinded trial comparing 1% Sandalore with an alcohol vehicle containing 0.05% sandalwood oil, which smells the same but doesn't stimulate the OR2AT4 receptor, so it makes it a pretty good placebo. There were 60 healthy female volunteers complaining of excessive hair shedding for at least 4 weeks, and they were all diagnosed with telogen effluvium. Again, the fact that these were female subjects is possibly not a huge deal, since this is not a treatment that is contingent on suppressing androgens in order to work like finasteride. After all, we know Minoxidil works with women too. 30 subjects got the Sandalore treatment, and 30 just got the placebo. Subjects massaged 2 milliliters of the product once a day for 24 weeks, which was the duration of the study. The subjects were evaluated at the start of the study and after 8 and then 24 weeks. They used visual assessment and tricograms, as well as patient self-assessment questionnaires. We'll go over exactly what they measured when we get to the results, but for now, it is reassuring to know they are using more than just self-assessments to measure progress, since oftentimes those can be subject to bias as well as influenced by factors like hairstyling, angling, as well as lighting, and it's fully possible to have hair look worse on one day compared to the last without having lost any ground due to such factors. So that is why self-assessments are usually a pretty poor tool for measuring progress. But anyways, so what were the results? Well, 5 patients dropped out for reasons unrelated to any side effects, so we are left with a total of 55 patients. First, let's look at hair shedding. Hair shedding was reduced in both the placebo and the treatment group, which is called VIRM in these graphs. If you look at this graph here, there was no significant difference between either of these groups. So this again is a very good reason why there should be a placebo group, because in the placebo group, the hair shedding got better, and if you didn't have a placebo group, you'd look at this and come to the conclusion that it was the Sandalore for sure, when it could have very well have just been the passage of time when the majority of hair follicles were in the anagen growth phase. Also, remember, this is telogen effluvium we're talking about here, not androgenic alopecia. Telogen effluvium is not permanent and often gets better by itself after the cause of the trauma which caused the telogen effluvium has ceased. So, looking at the next graph, there was an improvement in hair volume at 8 and 24 weeks with Sandalore, but not with placebo. The next graph shows that Sandalore also increased the ratio of terminal to vellus hairs as opposed to placebo, as you can see here. So for those who don't know what terminal hairs and vellus hairs are, terminal hairs are the darker colored, normal size hairs that are more likely to grow, and vellus hairs are smaller, more miniaturized, and often transparent hairs, which you often see increased numbers of in people with androgenic alopecia. Also, the ratio of hairs in the anagen versus the catagen or telogen phase increased in favor of the anagen phase hairs with Sandalore, while the placebo-treated patients had a decrease in anagen hairs, as you can see in this graph. Overall, more than 50% of patients treated with Sandalore had improvement in all parameters at 8 and 24 weeks, whereas only 20 to 40% of patients on placebo had improvement in any of the parameters, which is shown right here by these plots, where the blue color indicates the placebo group and the red color indicates the treatment group, and you can see a clear distinction at 8 and 24 weeks. Finally, the patient questionnaire showed that the majority of patients, whether they are on Sandalore or placebo, thought they had reduced hair shedding, hair regrowth, as well as stronger, denser hair, etc., though the difference in assessment scores was greater in patients receiving Sandalore compared with placebo. So it looks like the subjects kind of liked both treatments, maybe because both of them smelled good, but we know from the objective data that the Sandalore treatment was actually better than just the sandalwood oil, which is of course just a placebo. And there were no side effects, namely no scalp irritation, and it turns out the subjects really did like the way the stuff smells, and I agree with them. I've actually used Sandalore oil on my scalp before, just to make it smell better, and I think it really does improve the just the scent of your scalp. Anyways, to summarize all of this data, the Sandalore treated patients did have improved anagen to catagen telogen ratios in line with the earlier in vitro studies. It's also encouraging that Sandalore increased the ratio of terminal to vellus hairs, meaning it might be effective in androgenic alopecia, not just telogen effluvium, because in androgenic alopecia, terminal hairs turn into vellus hairs. The only difference is that it's the trash hormone DHT that is causing the miniaturization. But this might not matter in the case of Sandalore, since as we already know, its mechanism is not androgenic. So obviously, this is a pretty small study, though the study design is good, albeit potentially very biased since it was funded by the Giuliani Company. It is also limited to females with telogen effluvium, so I think we need more studies on Sandalore to see what effects it has on males, in particular males with androgenic alopecia, and we also need an independent study to help confirm the veracity of these results so we know the study is reproducible, at least the results are reproducible. So where does this Sandalore thing fit into a hair loss stack when fighting androgenic alopecia? Well, it is clearly no substitute for finasteride, since even though it works, it is not going to stop the underlying cause of androgenic alopecia, which of course is DHT destroying the hair follicles. So this treatment at best may be a viable adjunct treatment, which is similar to Minoxidil, although keep in mind Minoxidil is an FDA-approved drug with hundreds of millions of dollars worth of research, so there is no way we could possibly come to the conclusion that Sandalore is comparable to Minoxidil, at least not without a considerable amount of more human trials. Additionally, the commercially available forms of Sandalore are prohibitively expensive, some as much as $100 for like a 1-month supply, which make them impractical for long-term use for most people, especially since generic Minoxidil is widely available for as cheap as just $20 US for a 3-month supply, and sometimes you can get it for even cheaper than that, especially on Amazon.com. Minoxidil is obviously the gold standard when it comes to growth stimulants to be used alongside finasteride in any treatment plan for treating hair loss, but could Sandalore possibly be a viable alternative for Minoxidil non-responders, for instance? Well, maybe. We don't have enough data, but keep in mind that just because you are a non-responder to Minoxidil doesn't mean that you're fucked with Minoxidil. Non-responders to topical Minoxidil lack the sulfotransferase enzyme, which converts Minoxidil into its active form, minoxidil sulfate. If you are one of the few people who doesn't respond well to topical Minoxidil, which means after 6 months to a year, you haven't seen at least a slowing down of your progression or a halting of your hair loss, then you can try to mix 0.1% topical tretinoin with your minoxidil, and you can do that by just applying a thin layer of the tretinoin cream or gel to the treatment area, and then just give that a few minutes to absorb, and then you can go ahead and just apply the topical minoxidil as you usually would. It has also been shown that using stronger concentrations, meaning stronger than 5% concentration of minoxidil, while not necessary in regular responders, may actually help with 5% minoxidil non-responders. However, a lot of these 10 to 15% minoxidil solutions come from pretty shady websites where we cannot determine if the concentrations are accurate. So unless you can get 10 to 15% minoxidil formulated by a pharmacist, then I'd much rather just use 5% minoxidil with 0.1% tretinoin. And I talk about this in my 10 and 15% minoxidil video, which I'll go ahead and link below. But keep in mind, tretinoin, in most countries, it's available by prescription only. So you can talk to any GP and just tell them you have acne and you want it, and they'll give it to you because it's not a controlled substance. So it's very easy to get a prescription for it. So the bottom line is that in this industry, which is almost universally full of scams and flooded with overpriced garbage that doesn't work, anything at all that works even just a little bit will stand out, which makes Sandalore seem at least slightly promising. But as it stands now with the present research, the conventional treatments currently available like finasteride and minoxidil are much better treatments, and Sandalore at this point is just a mere curiosity. And in terms of future treatments, there are much more promising things on the horizon, such as WNT, Wnt pathway stimulants, as well as topical anti-androgens like clascoterone, as well as pyrrolutamide. So unless some breakthrough is discovered about Sandalore, I think we can safely just dismiss it at this point. It's just yet another one of these flavor of the month treatments that gets some initial hype due to some research, which looks good on the surface, but once you break down the research, you realize it's all pretty thin gruel. So I say we should just go ahead and ditch this overpriced weak sauce and just stick with the good stuff, which of course is finasteride and minoxidil. And don't worry, finasteride and minoxidil are not going to be the only things we have forever. There are more promising treatments on the horizon, and I'm willing to bet that 5 years from now, nobody's going to even be talking about Sandalore anymore. And with that, I think it's time to begin my Renegade playthrough of the Mass Effect trilogy. I have the Legendary Edition that I'm playing on my PS5, and it is sweet, so I'm going to go ahead and have fun with that. But I'm going to be back with some more content real soon, and let me just say it's good to be back. Take care.